New COVID cases in Hong Kong have jumped to its highest level since the pandemic began in late 2019. The sharp rise of mainly Omicron infections sent officials scrambling to free up hospital beds for patients. Isaac Lee reports.
There was more grim news today, with Health Chief Sophia Chen announcing a record number of COVID cases. Hong Kong added 351 infections, compared with 131 yesterday. Most of the new cases, 343 in all, were local transmissions. Of those cases, 161 were without known sources, also a record.
All the signs have told us that there are silent transmission chains in the community. I think it is important for us to stop all those activities and stop mixing. I think this is one way that the public can help, that everybody can help with this delaying, the spread of Omicron.
About 200 preliminary positive cases were reported, a sign that tomorrow's figures will remain high. Chen and her team followed up on measures announced by Chief Executive Carrie Lam yesterday. To alleviate the shortage of hospital beds, the Penny's Bay Quarantine Centre will accommodate from next week asymptomatic patients, or those with mild symptoms, instead of close contacts. If the situation worsens, close contacts may have to isolate at home for 2 weeks, while those living with them must stay home for 4 days. There is growing concern over the spread of the virus through vertical transmission across the city. Buildings affected include Sau Tai House in Fu Tai Estates in Tuen Mun, Leung Chi House in Leung King Estates in the same district, Po Ning House in Cheung Kwai No's Po Lam Estates, and a tenement building on 104 Fook Wing Street in Sham Shui Po. The blocks were partially evacuated. More cases have been found in Heng Ping House in Tai Heng Estates, which was opened this morning after a 2-day lockdown. All residents living in Units 29 have been evacuated. Yuen Long Plaza was closed after several security guards, cleaners and shop assistants tested positive. Isaac Lee, HKIBC.
The government minister in charge of the COVID vaccination program says restrictions will be extended to more venues, but stops short of giving details.
When we decide on what sort of social distancing measures that are required, basically we will look at the outcome and the effect of such measures, whether it would effectively reduce the flow of people in the community so as to achieve our objective of cutting all these transmission lines.